talking about making the hospital on the Northern Beaches a private hospital. They're going to amalgamate 2 public hospitals, and they're going to make it a private hospital. That really concerns me because of the stories I've heard about in the States where they have the private system, and if you don't have insurance, you don't get treated. Is this really true? Can't be really true.
Yeah, no, I know. It seems like it shouldn't be true. But yeah, in many instances, if you're trying to get a primary care appointment and you don't have insurance, you have a really hard time finding someone who will see you. Or you have to pay really, out of pocket, some pretty high costs. And then I think, very often people end up not getting care, but more often than that, people end up getting care but owing a great deal of money for the care that they get.
Really?
And then having to file bankruptcy or go to collections. People foreclose on their houses.
Because of their healthcare.
Because of their healthcare expenses, yeah.
So if I was an American and I came to your hospital and I had an exacerbation of my shortness of breath or something, which is a chronic disease, but I was from another state and I didn't have my insurance, I'm sitting there puffing, what would happen to me?
Yeah, so there is a law that was passed in 1994 that protects the rights of patients in emergent conditions presenting to either an emergency department or a labor and delivery department to get treatment and stabilizing care. But it doesn't go any further than that. So we would give you some oxygen and get you to feeling better, and then you'd be discharged.
Are you serious?
Yeah.
That's terrible,
really
even though
shocking.
I might
That's
have had
not how it works here.
No.
So tell me how it works for you if I was that same patient coming into your hospital.
So if you were that same patient coming into my hospital, you'd come in, you can go into a public or a private hospital.
Okay.
If you go into a private hospital, you can pay or you can use your insurance. It's either way, it doesn't matter. But if you go into a public hospital, it doesn't matter. I've got private health insurance, but I can go into any public hospital for anything and not pay a cent. Now, I can elect to use my private health insurance in the public hospital, and that will not change the standard of my care, whether I've got public or private insurance in the public health system. So I would be treated, I would be admitted, whether I've got insurance or not. I would be cared for, I would have all the support of the ancillary staff, allied health, without any concerns about my financial status.
Wow. And everybody has this public health insurance.
It's
not even insurance.
It's not even insurance. It's called Medicare. It's a 3% levy on our comes out of our tax.
Wow.
So everybody pays the Medicare levy, and that guarantees that we have universal health care for everybody.
Wow.
It doesn't matter young, old, rich, poor, anybody.